Aging is a gradual and continuous process that affects all body systems. Over time, the body's ability to maintain balance, repair damage, and respond to stress declines. These biological changes increase vulnerability to chronic diseases and reduce functional capacity. Older adults often experience multiple health conditions at the same time, which complicates diagnosis and treatment. From a research perspective, studying common diseases in the elderly and their underlying causes is essential for improving prevention strategies and long-term care. Example: an older adult who recovers slowly after a minor infection or injury illustrates how aging reduces the body's ability to heal and adapt, increasing the risk of long-term health problems. Cardiovascular diseases are the most common and serious conditions affecting older adults. They include high blood pressure, coronary heart disease, heart failure, and stroke. One major cause is the gradual stiffening of blood vessels with age. As arteries lose flexibility, the heart must work harder to pump blood throughout the body. At the same time, long-term exposure to unhealthy lifestyle factors such as poor diet, smoking, and lack of physical activity increases damage to blood vessels. These processes reduce blood flow to the heart and brain, leading to chest discomfort, shortness of breath, and increased risk of stroke. Cardiovascular diseases often limit physical activity and are a major cause of disability in later life. An elderly person with long-standing high blood pressure may feel breathless when walking short distances. Over time, reduced activity leads to muscle weakness, while an untreated condition may eventually result in a stroke and long-term mobility loss. Type 2 diabetes is a common chronic disease in older adults and develops gradually over many years. As people age, their bodies become less efficient at using insulin. Reduced muscle mass, increased body fat, and lower levels of physical activity further increase blood sugar levels. In older adults, diabetes symptoms are often mild or mistaken for normal aging, which delays diagnosis. Poorly controlled diabetes damages blood vessels and nerves, increasing the risk of heart disease, kidney problems, vision loss, and reduced mobility. An older adult with undiagnosed diabetes may experience numbness in the feet. A small cut can go unnoticed, become infected, and lead to serious complications that limit walking and independence. Musculoskeletal disorders are among the main causes of pain, weakness, and loss of independence in older adults. Common conditions include osteoarthritis, osteoporosis, and age-related muscle loss. Joint damage occurs due to long-term wear and reduced ability of cartilage to repair itself. Bone strength decreases as the body absorbs less calcium and produces less bone tissue. Muscle mass also declines with age, especially in individuals who are physically inactive. Together, these changes reduce balance and increase the risk of falls and fractures. As a result, many older adults experience long periods of limited mobility and dependence on others for daily activities. An elderly person with knee osteoarthritis may avoid walking because of pain. Reduced movement weakens muscles, increasing fall risk. A simple fall may cause a hip fracture, requiring surgery and long-term rehabilitation. Neurodegenerative diseases mainly affect the brain and nervous system and become more common with age. Dementia and Alzheimer's disease are the most well-known conditions in this group. These diseases develop slowly as brain cells lose their ability to function and communicate effectively. Reduced blood flow to the brain, long-term inflammation, and accumulated cell damage all play a role. Cognitive decline affects memory, attention, and problem-solving skills, making everyday tasks increasingly difficult. Over time, affected individuals may require constant supervision and care, placing a significant burden on families and healthcare services. An older adult with early dementia may forget to take medication or leave household appliances on. As the disease progresses, the person may need assistance with basic activities such as dressing or eating. Chronic respiratory diseases are common in older adults and significantly affect daily functioning. Conditions such as chronic obstructive pulmonary disease and asthma are often linked to long-term lung damage. With age, lung tissue becomes less elastic, and breathing muscles weaken. Long-term exposure to smoking, air pollution, and repeated respiratory infections further reduces lung function. These changes cause breathing difficulties, fatigue, and limited physical endurance. Frequent worsening of symptoms often leads to hospital admission and accelerated functional decline. An elderly person with chronic lung disease may struggle to breathe while bathing or climbing a few steps. A respiratory infection can quickly worsen symptoms and require emergency medical care. Mental health disorders are common in later life, but are often overlooked. Depression and anxiety are the most frequent conditions affecting older adults. The causes are usually related to life changes rather than aging itself. Chronic illness, physical disability, social isolation, and loss of close relationships increase emotional stress. Mental health problems reduce motivation, limit social engagement, and worsen physical health outcomes. When left untreated, they significantly increase the risk of long-term disability and poor quality of life. An older adult who becomes socially isolated after retirement may gradually lose interest in hobbies and daily routines, leading to depression and further physical decline. Cancer becomes more common with increasing age and is a major cause of illness and death in older adults. Over time, the body accumulates cell damage caused by environmental exposure, lifestyle factors, and reduced ability to repair genetic errors. The immune system also becomes less effective at removing abnormal cells. In older adults, cancer often develops alongside other chronic diseases, which complicates treatment decisions and recovery. Maintaining function and quality of life is therefore a key focus in cancer care for the elderly. An elderly patient with cancer and existing heart disease may receive a less aggressive treatment plan to preserve strength, mobility, and daily functioning. In conclusion, diseases in the elderly are closely linked to biological aging and long-term exposure to risk factors. These conditions often interact, leading to physical decline, reduced independence, and increased healthcare needs. Real-life examples clearly show how chronic diseases gradually affect daily activities and overall quality of life. From a research perspective, effective management requires early prevention, accurate diagnosis, and care strategies that focus on the whole person rather than individual diseases. Continued research is essential to support healthy aging and improve outcomes for the growing elderly population. If you would like to learn more about elderly health, disease prevention, and practical care strategies, please subscribe to our channel. Your support helps us continue sharing reliable, research-based information to promote healthy aging and better quality of life for older adults and their families.